Good afternoon. Good afternoon, Detroit, Metro Detroit, the state of Michigan, gracious America. We are in some crazy times, and here we are again with you, the COVID313 Coalition for Families and Youth. And my name is Jametta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network. I'm a mom, I'm a nana, and I am one of those women from Michigan. We hope that you have been staying safe and staying strong. But I would be remiss to say that we are moving into a period, if we have always said that we are in uncertain times and we are in unprecedented times, and we are being barraged with online information that we can barely understand. We're being barraged by the fact that we have a craziness that is around our vote and the power of our vote versus what other people want to acknowledge is the power of our vote. And we are in the midst of a pandemic that is wreaking havoc on our community. But by the same time, we're saying that we can and must keep ourselves safe, and we know how to do it. So as we move forward today, we want to do an invitation to you. One, we have a wonderful program. We have a focus on health, and we have experts, our physicians, coming to speak to us about how we need to stay safe and the testing protocols, the vaccine, and of course, other critical information like basic needs and what you need to know if in fact you need food and you're concerned about housing. But I want to say this, families, we've all been impacted by COVID. I've been impacted by COVID. My family has been impacted by COVID. So we must take a moment. I'd like to share with you what we're inviting you to do as well. I lost 3 wonderful people. My sister-in-law, who you just saw, my brother-in-law, Walter Harrison, who had that Detroit swag, Brenda Harrison, who was a sweetheart, and others. You too have had losses. Unfortunately, I learned about my losses too late because as families, we don't always stay connected and we don't reach out to each other. But we can do that to share our grief, but also our joy. I'd like for you to just join me for 10 minutes, feels like it, but 10 seconds, just to pause. Think about who you love, who you may have lost, and who you're going to continue to stay strong and safe for. Join me in 10 seconds of meditation and prayer. We also welcome you, families. Send us your photographs of your loved ones. They matter. In the midst of everything we do, your loved ones that you've lost matter. So let's take that energy, that pain that we feel, and let's use that to move forward. So that's what we're going to do. We're going to move forward with our program to keep ourselves safe, strong, address the contradictions, and stay socially active as warriors for peace, justice, and good health. And I am so happy, as always, to be joined in this wonderful work that we do by co-moderator Christine Bell, who's going to take us through some more of our program, and you'll hear our powerful voices from families, health, and experts. I'm breathing. Christine.
Jametta, your family is beautiful.
Thank you.
I'm sending you a lot of love right now. I'm Christine Bell. I'm the mother of 3 really wonderful children, one of which is doing a checklist right next to me for his online learning. So you might hear a little bit of background noise, and I apologize for that. I'm also honored to serve as the Executive Director of Urban Neighborhood Initiatives and a proud member of this coalition. We are translating the town hall to Spanish and ASL. So we want to give folks time to get in the right place and get comfortable. Cindy, will you please share the phone number for Spanish translation? And if not Cindy, Christina. Oh, nope, there's Cindy.
Hola, si necesita traducción en español, por favor, hable al 313-626-7440, 313-626-7440.
All right, I just want to make sure. It looks like we still don't have ASL on the line yet, and so we will come back to that. I have a few more logistics to work through. We want you to stay with us for the next 60 minutes so that you can stay informed and stay powerful during this incredibly difficult time and what feels to be never ending, but it will pass. But we've just got a little push through a little bit more. We want you to know that these are two-way conversations, and we want to hear from you. We want to make sure that you ask your questions, and if you have comments that you share those with us. And the way in which you do that is you can put the questions or comments in the Facebook chat, or you can text your questions to 313-288-2082. Again, that number is 313-288-2082. There will be a question and answer, time for questions and answers after each segment. If we can't answer a question today, we're committed to getting the answers to you by next week. And all the questions that are asked today with the answers will be posted on onedetroitpbs.org and also on their Facebook page. For our experts, please remember to speak slowly for our translators. They want to make sure, and even slower than I'm speaking right now. So please speak slowly for our translators. They really want to make sure that they are translating the important information that you are sharing correctly. Please turn off your cameras when you're not speaking to ensure that our ASL interpreters can be seen. And please remember to mute yourself when you're not speaking. Terry Whitfield is our timekeeper today, and he will chat you your remaining time. So please make sure that you are paying attention to your chat. And then if you go over your time, Jametta or myself will come onto the screen and gently remind you to wrap up. And it looks like we're still waiting on our ASL interpreters. So I will hopefully be coming back to give you those instructions as well. But we're going to keep the program moving. And so it is my honor to welcome back Cindy Gamboa. Oh, Cindy, before you come on, it looks like ASL is here. So we're going to wait just, yay, Katie's here. Katie, could you give the instructions for ASL interpretation? Thank you so much, Katie, and it's so good to have you back with us. So we are in the part of the program where I am welcoming Cindy Gamboa, who we've not seen in a few weeks. It's so good to have you back. And so Cindy's going to kick us off today.
Thank you, Christine. And Jametta, thank you so much for that grounding, that warm opening. It meant a lot for me. And I know it meant a lot for a lot of folks that are listening right now, just to make sure that we're grounded and remember why it is that we're doing what we're doing. So thanks everyone for watching. My name is Cindy Gamboa, and I'm glad to be back with you guys today. We do have an amazing lineup of speakers today that are gonna share really great information and resources. But before we do that, I want to pause and give ourselves a reminder that we need to please be kind to ourselves. Be kind to yourself. As a mother of 3 kids, I realized that a lot of times I'm not too kind to myself. I'm finding myself that I'm constantly doubting if I'm doing enough. Feels like there aren't enough hours in a day to accomplish all of the demands that are being thrown at me right now. and still stay up to date with all of the rapidly changing information that I need to know in order to keep my family and community members safe. And to top it off, we're still grieving. We're still grieving the loss of family members and community members. So please just take a moment and be kind to yourself. I know I have to pause when I find myself questioning, am I cleaning enough at my house? Am I cleaning? Am I being supportive enough of my child during his virtual learning? Or, questioning why my daughter isn't excelling in school right now as she normally would have if she was in face-to-face school. But reality is that we're all struggling with this kind of thing, and we have to be kinder to ourselves. The more I talk to family members and friends, I'm realizing that a lot of parents are in the same position as I am. A lot of people are overwhelmed with the expectations and the things that are being thrown our way and the emotions that we're having to deal with. This pandemic has caused a lot of frustration, anxiety, and I want to tell you that you're doing a great job. You have to be nice to yourself and recognize when it's time to take a break, when you should be asking for help if you need it. Remember, self-care is whatever feels good to you and whatever you need to help you recharge, whether that's workouts that sometimes I tend to skip out on, or simply just unplugging from all of the technology that is kind of being forced on us and pushed on us. Do something fun with children or anything that's really going to help invigorate where you're at right now. But whatever you do, please continue to do your part to ensure that we stay safe and healthy. We need to all do our part to get back to normal, whatever that normal may look like, right? Because it's going to change. We need to keep respecting safe social distancing measures, wear our mask, not gathering in large numbers to ensure that our family members and friends are safe. I know for me during this holiday season, last week, I was faced with the tough decision of whether or not to visit family members for Thanksgiving. And it seemed like the hardest thing that I had to do recently. I have a very large family, and for us, it's almost taboo to say that you're not going to show up for a family gathering. But out of love, care, and respect for all of them, I chose not to gather and stay home. I did this, but I still found other ways to stay connected. I can't tell you how amazed I was at the feeling of connectedness with seeing my phone light up with the text messages, with the FaceTime, calls. It was a sigh of relief and love and care that we're still thinking about each other, even though we're not physically in the same space. So I'm asking all of you that are listening right now to please continue to look for ways to stay safe. And I want to thank you for everything that you're doing. We don't always give us ourselves enough credit, but you have to realize that we're surviving and we're thriving during a global pandemic. Please realize that and continue to celebrate that. I'm sending you all my love and wishes for safety and peace. Thank you.
Cindy, thank you. And you're sharing the sentiments that all of us have, which is parents in particular. We know so often people are saying what you don't do and what you can't do. You are holding it down in the midst of a crazy time for all of us. And whether you are a parent, a grandparent, a working parent, a stay-at-home parent, this is an incredibly difficult time. And we are all in it with you. We all are part of this, and we are here to love on each other, but also every week is to bring you experts and to bring you information that helps us make it through this bizarre time. And so we are in the midst of recognizing the high levels of unemployment. We know that there's concern around basic needs from food to housing. And we're always so pleased that here in Metro Detroit, we have the Wayne Metro Community Action Agency that has been here consistently for us to provide resources. And I'm really so pleased to welcome to the program Hiba Haidus, who is the manager for probably everything that has to do with basic needs at Wayne Metro. Welcome, and please share information and tell us more about yourself as well. Go ahead.
Thank you so much. Can you guys hear me okay? Everything good?
Yes, we can.
Thank you. My name is Hiba Haidus. I'm an outreach manager at Wayne Metro Community Action Agency. I'm going to give a little brief background about myself. Although it seems just like yesterday, I began my career at Wayne Metro in March of 2019 as a community resource navigator. I found myself on the right career path, helping those in need and serving as an asset to the community. I always thought to myself, what's more important than your basic needs? I assessed, I processed, I worked alongside with clients towards self-sufficiency. And a year and a couple of months later, I was promoted to become the outreach manager. All along the way, I learned that we had over 75 programs that help those in need. I work out in the community when it's necessary, and I dedicated my attention and knowledge in our programmatic side. I'm now overseeing one of our main programs, which is the Water Residential Program, which is referred to WRAP, and I will explain that in a bit. The next slide, please. So our mission and vision aligns with what we do every day. We want to empower all the communities to be strong, healthy, thriving, and our mission is to help those in need into the path of self-sufficiency. Our core areas are youth and family services, community and economic development, and my area, which is basic needs. This slide shows how to get help from Wayne Metro. Our phone number is 313-388-9799. You can also chat with us on our live website, which is www.waynemetro.org. That is also our email, our website to visit with all of our resources and flyers on it. Also, you can email us at Wayne Metro Connect Center, which is wmconnectcenter@waynemetro.org. Next slide, please. So our service, we have one of our main programs, which is WRAP. It's referred to the Water Residential Program. This allows clients that have a 200% poverty guideline or below to participate on a payment plan that allows $1,000 annually. So for example, if a client has $700 in their past dues, that arrears gets frozen. It's towards their back balance. We will freeze that amount and pay that payment for them in 2 initiative payments. At first month of enrollment, $350, and at the very end of their enrollment, if they're successful, another $350. At the same time, we want to give clients $25 credit towards their water bill each month. So that equals out to $300 in a year. Next slide, please. We have, for our water program, we have the conservation, in which includes in our water program, if applicable. We always want to look at the client's water usage. So it's not only just important for us to enroll this client in a water payment or a plan, but it's for us to actually communicate with the client and explain to them their water bill. So for instance, if a client has really high usage, that means their water bill is going to be very high each month. We want to do that assessment with the client, let them know about our home water audits in order to figure out if they have any minor leaks or anything that can be fixable. We have a team that goes out and fixes any plumbing repair up to $1,500. The most important goal is for our clients to have hot and cold water, a functioning toilet, a faucet. We do have a home plumbing repair application included in our website. Next slide, please. Thank you. Next slide. Sorry. So our next program is the Michigan Energy Assistance Program, which is referred to MEAP. It's the utility assistance program that allows us to pay towards their energy bill. The client applies, this works a little bit different. The client needs to apply for a state emergency relief through MDHS. When the client receives that approval, on the side, it will tell what MDHS is going to pay, and then it gives the client the co-payment that they have to pay. This is where the client comes to us, gives us that approval letter, and we pay their co-payment. Before the pandemic, we were allowed to pay up to $2,000 towards their DTE bill. Now during the pandemic, it got raised up to $3,000 towards their co-payment, which is a big help. We also put clients in a LSP, which is referred to a low self-sufficient energy plan. This allows clients to be on a payment plan through DTE, which gives clients a set bill of $95 or $135, depending on how much energy they use at home. So both of these are in our MEAP program, and it's really helpful for these clients. Next slide, please. We also have MyBridges. So we have certified MyBridges navigators to log in or to even create MyBridges account for clients that need help to apply for state benefits. A lot of clients need, to apply for the state emergency, but they don't really know how, or they don't have that internet access. We provide navigators to help these clients to do so. Next slide, please. Housing. We have shelters open during this pandemic. We are actively involved to participate in Homeless Services Coalition, supportive services for veteran families, and a lot more. In the next slide, it's Wayne County. We are part of the Eviction Diversion, is another program we have. It is a partnership between multiple community organizations, housing assessment, resource agency, community action agency, and local legal services in districts and courts. Tenants do not need to demonstrate a COVID hardship to be eligible. They just must have court documents to be eligible. For Wayne, we temporarily closed the application due to funding because we have a lot of applications to go through. For the Detroit application and Highland Park Hamtramck, the number is included in the PowerPoint. It's call 866-313-2520, and so you can get that application. Food distributions. Currently, we have 3 locations that we are out every Friday from 10 to 2. We are serving up to 500 families and plus. We started this pilot in June, and it got extended to June of 2021. We have dedicated staff out there in the hot days, and now the cold days are approaching, and we're still going to be out there. We extended it because we realized the need of food is so high. We are hitting high records and serving families of 600 and plus. We have 3 locations, and then we are looking for a 4th location. Our first location is George Washington Carver in Highland Park. Then we have our Wayne County Community College in Taylor. We have St. Albert the Great in Dearborn Heights, which was one of our Head Start programs. We distribute produce, hygiene boxes, meat boxes, and Q boxes that include dairy products, pastas, canned food, and many more. Next slide, please. We have also our marketplace. It was a 9-week pilot, which ends unfortunately this month. We serviced about 3,000 families so far. Clients go on the Alice website. They order about $400 worth of food for them and their family, and they actually get it delivered to their house. This was particularly targeted for the Detroit specific area. It was a really successful pilot, and clients were really thankful. Next slide. We have our early Head Start and Head Start programs. We have these programs for children ages from newborns to age of 5. Unfortunately, during this time, we are at a virtual format, but we are still in full speed and doing it virtual. We also carry baby showers and diaper distributions. While supplies last, please call the Connect Center so you can note those dates. And baby showers are on hold for now, but we do have diaper distributions. We have the job and educational development. We help clients prepare in education and educate in career development and help them find what best fits them. Next slide, please. We have our financial education, which is a financial empowerment center, which offers free one-on-one financial counseling and includes a home buyers club, which prepares home buyers to participate in a down payment assistance program. Clients and staff address financial challenges, barriers, just different sorts in this appointment. And it's all held virtual as well. I also want to mention for my last part, we do have a tax preparation where we can apply for free tax preparation, which is all year round. And also we included that in a virtual format. Again, we have over 75 programs. I can go on all day explaining them, but please visit, we are available, we're assisting, we're working during the holidays. We have staff working all around the clock. I do want to mention, yeah, we are in a virtual format, but work is not stopping because there's a need in our community and we're here to help the community. Again, our phone number can be found on our website. And our phone number again is 313-388-9799. Thank you.
And thank you, Hiba. That was a ton of really critical information that we know so many of us need. Let me stop. I hope that we have some questions. Christine.
Yeah, thank you. That was great information. Is assistance available to everyone, or do people need a Social Security number to receive assistance?
So all of our programs have different guidelines, but for RAP, you don't need a Social Security number for you to get that assistance. That's why we share our flyers and our eligibility. I don't want to, ever close out an option for these clients. We always have that available, but there are poverty guidelines to follow, like that percent, it has to be followed. So for instance, for RAP, it's 200% poverty guideline. And that's just depending on your income, how much you have for, that certain person in the household. And then MEEP, it's 150% poverty guideline.
And then do you have funds available for training dollars? So if someone wants to go back to school or went to school and needs to pay a remainder of a balance of that education, do you all have programs for that?
So we don't have programs specifically to that. I always advise all my clients and all my staff to tell clients when you need that sort of help to connect with our Connect Center, because our Connect Center has just different resources. If we don't have it in-house, we do a really good job of referring out. So we will we will connect with different agency, different community action agency, different resources to see what clients need and what best fits them for a program.
Great. Thank you so much for being here. This was a really wonderful presentation. So thank you. Jametta?
You're welcome. And thank you for having me.
Yes, thank you. And thank you, Wayne Metro, always for making sure that we have resources. And we want to remind families that as you have questions, remember that you can reach out to us through the Facebook, or you can chat us at 313-288 2082. I'm going to repeat that again, 313-288-2082, because you may really have some questions as we move into our health segment. And within this segment, we're really so delighted to have Dr. Philip Levy. Phil is not only an MD, but he is also the director of the COVID313 mobile testing unit that some of you may have been hearing about. He is also a professor and a vice president at Wayne State University School of Medicine. And we are eager to hear your assessment about what we need to better understand, not only about testing, but its availability and how critical it is for our ongoing health, as well as other key health issues. So having said all of that, Phil, welcome.
Thanks, Jametta. It's great to be here with you, and so nice to see so many participants interested in hearing this. So yeah, we're going to talk a little bit about COVID testing, where we've been and where we're going. But before we get started, I think it's critically important to emphasize the last point you made, that we're hearing a lot in news about vaccines. We're hearing a lot of different things out there, but none of this is going to be immediate, and none of this is going to reach the masses as much as we would like it to that quickly. If you're following the news on this, we're talking spring to summer before we get beyond the initial populations that are going to be targeted for vaccine administration. So it's going to be really important that we continue to social distance, wear masks, and get tested. The single most important thing testing provides is the ability to determine who has the virus and who doesn't. That way we can effectively separate who is contagious and who isn't. And again, that's the name of the game with all of this. Just before I get into this too, some of you guys may have seen the CDC's updated guidelines that were released yesterday, talking about how we determine when someone is a close contact and who should get tested and whatnot. Importantly, that period of time, the critical period, is 24 hours, how much time you've spent around a person who tests positive. But now they've made new rules, because they used to say if you were a close contact, you were within within the past 24 hours, if you were within 6 feet of somebody for a cumulative 15 minutes or more, you were considered a close contact and you were out basically in quarantine for 14 days. With the new rules, it's 10 days in quarantine without testing, or 7 days if you test after day 5. So testing has an additional value to help people get out of quarantine. So that's important to remember. So our program here is really one that's geared around making no barriers for testing. We've developed a mobile testing platform that's a key pillar of the state's coronavirus task force to reduce health disparities. And we started doing our testing before the task force came together in mid to late March. And our goal from day one was always to provide no cost, no prescription, no ID or insurance testing. We do collect insurance because if it does cover testing, that helps us allow, or that gives us the ability to do more testing for more people, but it's not required. We test everybody, those who are asymptomatic, ages 3 years or older, and we generally get our results back within 48 to 72 hours, depending on how much volume there is in the queue for testing. Next slide. And so, part of this was our goal is to reach the difficult to reach. We know that getting into healthcare these days has been challenging. People are fearful of going to the doctor, going to the hospital. And when you go to those settings, you can't always get the testing you want. So mobile testing is a solution that we devised working with the Ford Motor Company and now working with Detroit Parent Network. We have developed a system where we can go out into communities and bring testing to folks instead of waiting for testing to come to them, or making it that they have to drive a certain distance or go to a standalone testing center. We move into neighborhoods and provide testing where people are, and really meet the needs of people where they're at. Next slide. And so these data are in the midst of being updated, but they're accurate as of about a week ago. This is since April 13th, the number of tests that we've done through our mobile program, almost 26,000. It's now probably close to 30,000 with the last couple of days and week of updated testing. But as you can see, we've done a large amount of nasal swabs and antibody tests. Our overall nasal swab positivity is about 8.5%. Antibodies a little bit higher. I'll get into the distinction between those two in a minute. And as you can see on the left side, the majority of our tests have been done in the city of Detroit. Next slide. And it's important to understand when you test why you're testing, what you're testing for. So this is a confusing slide, and it's not meant to be confusing for you. But if you look here, you can see the blue line, which is nasopharyngeal swabs. About a week to 10 days before someone develops symptoms, when they're first exposed to COVID, is when you're going to start to detect the virus in your body. That's what we talk about when we mention nasopharyngeal or oral pharyngeal or any virus itself. The virus itself is what we're trying to detect when we do those swabs. That will be present for about a week and a half before symptoms start, and it will linger for a while, sometimes up to months at a time, depending on the individual. So the two different types of tests that are generally out there that we do are nasal swab testing, and then there's also antibody testing. Antibody testing looks for the reaction in the body to the infection. So again, the two test types. One is looking for the virus itself. We try to capture it and then identify the virus. And the other is trying to identify the body's response to the virus. Both of those give us complementary information. There's also antigen testing, which you might have heard about. Antigen testing also looks for the virus, but it looks for a piece of the virus, not the whole virus itself. And it doesn't specifically identify active or live virus. It identifies just the presence of the viral particles or some of the proteins of the virus. And as you can see, the antibody response usually doesn't start to kick in. That's the dotted lines here. The antibody response doesn't start to kick in on the other side until about a week to 2 weeks after you get exposed and start to develop symptoms. Now, mixed into all of this is that you have a lot of people who are asymptomatic. And so, this cut point of symptom onset doesn't hold true for everybody, because those asymptomatic folks can be infected somewhere in this area and never really know kind of what their time frame is. But suffice to say, the most important thing to recognize is that about a week to 10 days after exposure, you're going to start to peak your antibodies, but they will start to appear early on. And then, you'll start to peak the viral detection. It will start to appear early on and then wane over time, but can linger. And then on the other side, the antibody response will pick up about a week to 10 days later. Next slide. And when we talk about the different testing that you do, it really depends on what you're trying to figure out in the population. If we're trying to diagnose who's infected and has symptoms, the lab testing, the viral testing, which is otherwise known as molecular testing, and antigen testing is really good. If we want to look in the general population to see how much of the virus may be present, we can use it for this purpose. If we want to know who's safe to go back to work or potentially work, be in other environments, we want to know who has the active virus, or at least who has virus in their body. When we want to look at who has been exposed in the past or how prevalent the virus is in the community, we can look at the human responses and then take it from there. Next slide. So the participants in our program to date have been largely African-American, reflective of predominantly testing in the city of Detroit. But as you can see, we have a nice mix across races and ethnicities. And in particular, we do a lot of work with Access in Dearborn, and we have a large representation of Middle Eastern and Arab American populations. Next slide. And while the primary language of our participants is English, you can see we have a large amount of Arabic and a relatively small amount of Spanish speakers. All of this makes it important that we have the resources on site to enable our ability to communicate with the folks who are there to be tested. Next slide. And we also want to make sure we're reaching the populations that are difficult to reach, as noted. So while most of our populations don't have disabilities, you can see that there are a number of different disabilities that people may have. And so ensuring that our testing sites can accommodate these disabilities is critical to provide testing for the masses. It's also important to recognize that while most people in our testing program don't have disabilities, there's a lot of people in the community that do. So alternative means of reaching those with disabilities is important, particularly the potential to go to facilities where those with disabilities rise, and even the potential to go into people's homes and do testing there if that were of interest. And our program is equipped to do all of that. Next slide. And so our program began, as I said, in mid to late March. And the first thing that we did early on was try to figure out where in the community the majority of the COVID was present, and can we go out into those communities and reach the populations. And in particular, go to communities that have a confluence of factors that we know make it more likely that people will get infected and put them at risk for developing consequences. So here you could see these data from March 29th that Sinai Grace was a concentrated area early on, and not surprising, it's surrounded by elderly populations who have a lot of social vulnerability. And so early on, we started targeting those areas to, again, try to separate those with the virus from those without. Next slide. We also started recognizing early on that other factors like high blood pressure and cardiovascular disease are important risks for both developing COVID and, more importantly, developing complications. So we started to overlay data for these factors and really started to think a little bit differently and say, we have an opportunity here to go do COVID testing, but if we're in communities that also have other factors that need to get addressed, why don't we start to think more broadly beyond just COVID testing? Next slide. So our next goal then was to deliver more than COVID testing. And while we started early on doing nasal swabs, and I mentioned that we do antibody to get a sense of just how prevalent the infection may be even amongst those who test negative, we started adding on other things that we routinely do in some of our community outreach efforts through Wayne State and Wayne Health, including HIV testing and blood pressure measurements and doing things like lipids and A1Cs. A1C looking for diabetes. And importantly, we started adding patient navigators and doing intake to figure out who needs connectivity to medical services, again, because COVID has made it very difficult for people to get into their doctor's offices and made it uncomfortable to go to the healthcare setting, but who also needs social services like our previous speaker was talking about. So by having navigators on site, we can deliver a lot of those services at the point of screening and testing so that it makes it very easy and convenient for the individual who's coming to us. And as you can see on the far right, this was some early work we did with Dabo for fresh fruit and produce distribution. Next slide. And so that required a lot of engineering of our workflow. And perhaps the most important thing that we did was create a streamlined mechanism for intake using something called PEG. So people can fill out a survey before they get to the site. They can fill it out when they get to the site, but that allows us to facilitate their throughput so that people don't need to spend more than just a couple of minutes getting their testing done and getting through the process so that they can go about the rest of their business. Next slide. And what we developed with PEG was a way that you can test the number, and PEG stands for Patient Education Genius. You could text Wayne Health Cares to 48355, and we have various customizations around this cares or that cares. When we work with DTE, it's DTE cares. We work in Macomb County, it's Macomb cares. But we created this survey that you text this number and a link pops up on your phone, and then that link gets some information on consenting for testing and symptoms and all the like. Next slide. But we also really wanted to make sure we got information on, do people want to be connected with a primary care provider, and do they need assistance with social services? And if they do need these things, we know immediately on site, and those navigators can make appointments and make connectivity for individuals who need any of these types of services. And again, this is the great part of the connection with Jametta and Detroit Parent Network. They've been instrumental in providing the ability to do this on site and providing the linkage to care activities that are so critical to make it more than just testing. Next slide. We also collect some information on discrimination and barriers to testing and things that can help us better deliver testing in the future if we know why people couldn't get tested previously. Next slide. And like I said, we do things like blood pressure, and it's an important thing because we know the relationship. So now, measuring blood pressures on site and linkage to care for hypertension is going to produce much more ability for us to affect the outcomes related to COVID for the individual themselves than just testing alone. So it's critically important, again, that we do these types of things. Next slide. And we're at a point now where we have a lot of data on this, and we know where the prevalence of the caseloads of COVID exist in Michigan. And interestingly enough, while Detroit was the hotbed early on for COVID caseloads, it's gotten better lately, and it's now the surrounding suburbs that are seeing a lot of the burden of this disease. And so what we do on a regular basis, next slide, is update data for our mapping every week so we can figure out where the largest rise in cases are week to week, and then we can plan outreach. So as you can see here, these black diamonds are where our future upcoming test sites are located. And we try to do, as you can see, we try to make sure that they are in communities where the cases are rising, again, so we can identify those with condition and without condition and separate them out. And as you can see here, the red numbers are regions where cases are rising 12, 15, 18% on a week-to-week basis. Really, really important stuff. In fact, we tested in Pontiac 2 weeks ago, and 50% of those we tested in Pontiac were positive. So that type of stuff is really, really important. The sooner we can identify the people with COVID and separate them from those without it, the better off we are. Next slide. And all of this information can be found on our website at Wayne Health. If you go to waynehealthcares.org, it'll take you right to our COVID response test page. And at the bottom of that page, next slide, is where we list out all of our test sites. So we have a schedule, as you can see, where you can click on an individual listed site, and that will pull up information on where the site is located. You can get mapping information if you want, and it'll tell you what type of testing and offerings we have at the site. When it says COVID-19 testing, that's generally a swab testing, but we do incorporate blood-based testing, like I mentioned, doing blood draws on site for serology and other things. And like I said, high blood pressure and HIV. And nobody needs to schedule this. They can just show up when they want and we'll test them. Next slide. And importantly, as we move forward, we're like I mentioned, part of the state's task force for health disparities, and we have 5 vehicles coming our way, 3 of which will be available next week, that are fully upfitted vehicles that have a number of different amenities that make testing easier. But this is what you'll start to see on the street and at our sites going forward. Next slide. And as I mentioned, these vehicles are being upfitted, and an important component of what we're doing is including refrigeration, medical grade refrigeration, so that we can store vaccines in the vehicle, at least the vaccines as of now that don't require super cold temperatures. But as of this morning, we're in the midst of figuring out if we can get -70 freezers into our vehicles so that we can do mass vaccine administration and be part of the solution for that end. And I think that's the last slide. And with that, I think I have time for maybe one question or two, but if not, my email is plevy@wayne, WAYNE.edu. You can feel free to email me any questions you have, and I'll get right back to you.
Wonderful. Thank you so much, Phil. Dr. Levy has provided us a huge amount of information, and in just as much as you gave us a miniature masterclass in testing, you also gave us the source to get more information. Christine, questions?
We do have quite a few questions, actually. Thank you so much, Dr. Levy. That was really informative. Do you know when the vaccine will be safe for children?
The only vaccine trial right now in the pediatric population is in Moderna, looking at 12 to 18-year-olds. There are some younger age trials being planned, but they're not fully initiated yet. You know, the whole thing about the safety of vaccines is going to be tough because we're not going to have long-term data on vaccines because of the acuity of the pandemic. Normally, we would wait a couple of years to understand the safety of vaccines, but we don't have that luxury of time right now. So I guess the short answer is we're going to have to extrapolate some of the data from adults to children, but it's going to be an evolution to understand the safety of the vaccines overall.
Great. And then how accurate are these tests? How often should people get tested?
So that's a good question. The molecular test itself is 100% accurate in the sense that if there is virus on the swab, when I obtain the sample, it will detect it, period. There's no question about it. What the molecular tests do is they find a portion of the virus called RNA, riboxynucleic acid, and what they do is it amplifies that signal. And the amount of times it needs to repeat the amplification can tell you how effective not how effective, how infected the person is. The lower number of cycles needed to amplify, the more infected you are. But it really depends on how adequate the acquisition was. So if I don't get a good sample, you could still be infected and I won't detect it because there's no virus on the swab. And that may or may not be incumbent on the person doing the test. It could also be just the part of your body where I happened to touch with the swab and maybe it wasn't there at the moment that I was testing. And so there's a lot of nuances. And when we talk about false negatives with the molecular test, it's because we didn't get the sample correctly or because it wasn't there. The antigen tests are a little bit less accurate, and those tests tend to have more false negatives and more false positives than the molecular tests themselves. The antibody tests are very accurate in terms of detecting when somebody's developed an antibody response, but because that takes a while to develop, it's not a good test to tell us if somebody's infected. It's really only good to tell us if somebody's been infected in the past, and we don't even know how long ago that infection was based on the test, but we presume it's at least 2 to 3 weeks prior to the point where you develop those antibodies. So the tests are generally really accurate for what they do, which is, you know, what each one of the different tests does, but there's a a lot of variability in terms of how the samples are acquired that can affect the test results themselves.
So this is related to what you just said. And so most of us, the average person that's going into the doctor's office to get tested, you're getting a nasal swab, right? You're getting the nasal swab test that takes, 48 to, it was taking almost 7 days to get the results back, or you're taking a rapid test. And so of those two, and then there's the antibody test. Of those two, in what you just described, this is again, how accurate are the different tests?
Well,
Do you recommend one over the other?
Well, the most accurate and the gold standard for detection of the virus is the molecular or PCR test. And that is the one that we want to use to say someone is infected or not, period. And it can still detect the virus after the acute period if it's lingering in your body. It really tells us if the virus is present in your body or not. And with that caveat that if we don't get an adequate sample, it can be what's called a false negative. The blood-based antibody test really should not be used for population level screening of acute infection, period. We don't do that. Nobody advocates for that. So if somebody's offering you a finger prick test to tell you if you have COVID, that's not the right way to go about it. You can get a finger prick test to tell you if you may have had COVID in the past, but it's not going to tell you you have COVID, you don't have COVID, you're good to go see your family, you're not good to go see your family. Those are the important things that people need to know. And it's also important to remember, that it's just difficult in populations who don't have symptoms to really best understand the test results, because the test results have to fit within a clinical context. If you're sick with a fever and I test you positive, it's most likely a positive. If you're completely asymptomatic and I'm just routinely screening and it comes back positive, you have to look at it and say, is this a true positive or a false positive? Because if there's no likely scenario where you got exposed, you have to question the test result itself. And we've seen this a lot with things like sports teams and movies and all these types of things where they're routinely testing people and positives come up all the time that end up being false positives. So it really depends on, how someone's symptoms are. And I want to touch on one other question. I know we have to get to some other things here, but how frequently should people get tested? I didn't answer that question. The reality is it depends on how frequently you may potentially be exposed and what your symptoms are. If you're symptomatic, you should always go get tested, except for the fact if you've already had COVID. Part of the new CDC guidance is don't bother getting tested within the first 3 months after you have a positive COVID test. There's no need for repeat testing after the first 10 days of the positive test because you're infectious for the first 5 to 7 days and then it goes away. You could be positive for a while and it's just a waste of resources to retest you, and B, not useful because it's misleading information that may cause false concern on your part when you're no longer infectious. I'd say the most important thing is that you can't use the test as a surrogate for good social distancing and prevention measures. If you need to be home, stay home. If you can work from home, stay home, and don't push it. You don't need to get together with family now. I know the holidays are coming up and it's hard, but just be responsible and be respectful for all of those around you.
Thank you so much, Dr. Levy. That was going to be my last reminder was to talk about the frequency. And there is somebody that said, and so Jametta, I'm going to say this to you. Could we add support for parents in this line of service? And I think what they're asking is can we provide support so parents know ways to support their kids? So Jametta, I think that's for maybe you can think about what that might look like since you're so engaged in this. And then also somebody had said, I'd like to advertise in my neighborhood newspaper, Green Acres. Who should I reach out to schedule one in my neighborhood? And I would say Dr. Levy just gave his email address and he said he would respond to it. So we're going to drop it in the Facebook chat. Please email him. We want to remind everybody to be sure to post your questions in the chat, or you can text your questions to 313-288-2082. Thank you so much, Dr. Levy. That was super helpful.
My pleasure.
Jametta, back to you. Thank you.
Yes, and thank you. And it needs to be stated that you particularly identified one of the other critical populations, which are Hispanics and also Native Americans have been disproportionately affected through COVID. And we're really pleased to say that the coalition has members who are also now going to be participating in some of the mobile locations. So I know we're looking forward to the partnership with Chaz and also, yes, also with Uni. We are saying to the entire audience that is here is please don't hesitate. If you are a school, community-based organization, a church, or you're part of a civic group that has concerns, is to please reach out because we need to do testing with you. The other thing is to our communities that have disabilities. Phil, you said something that was, I thought, really important. How do we facilitate access? And that there's a possibility for in-home disability testing. So those were two things we wanted to lift up. Please be in touch with the COVID313 mobile testing unit so that we can make sure that our community is safe.
Thanks, Madam.
Phil, thank you
My
so
pleasure.
much. Okay. We are going to continue our focus on health, and we're so pleased to have join us and who has been, I feel like you're almost part of the family, Dr. Fuller. And Dr. Fuller is a physician of infectious disease and has done a great deal to help us better understand the complexity of this disease for those who didn't understand that. So Dr. Fuller, welcome back.
Thank you so much. It's always great to be with the 313 Coalition. As I told you, it's one of my favorite groups because of how well you work and what you do. You really never cease to amaze me. So it's good to be back with you. I wish we were out of this pandemic, but we're not. But there is light at the end of the tunnel, hopefully. So what I want to do today, and by the way, I'm not a physician. I'm a researcher, a professor who teaches physicians and dental students and those people. So at any rate.
Okay, thank you for the correction.
Absolutely. What I want to do is to just run you quickly through a couple of things with reminders and refer you to something that we have been doing for the last several weeks that help prepare people for the holidays, and then hopefully spend a little bit of time talking about some of the positive things that we can do, because I know everybody's really tired. There's something called COVID fatigue that we're all suffering for, but I believe there's light at the end of the tunnel. And if we can just get to that safely, we'll be good to go. So what I'm going to show you now are some of the things that are in this session that we've been doing from popular demand and because the need was there, and also anticipating the coming holidays. It's called COVID Conversations, Families, Friends, and Workspaces, What You Need to Stay Safe. This is the YouTube site. It was a 90-minute session. I was joined by a colleague, Dr. Talia Phillips, who is a family medicine physician, and also Brian Caldwell, who actually wanted to have this for his company, moderated all of the events. So that it's posted. I encourage you to go there. I think you'll be really informed about what to do and what COVID is, how it works, and what you can do as people who are concerned about this. So this is, again, the YouTube address. I put it into the chat as well. So just a reminder that we are in the holiday period where these things are coming together to form what some of us call a perfect storm for COVID. And so there's a high surge, which I'll show you in a minute. I'm getting to this to tell you why we can do some positive things. We're in the winter season where people cluster inside versus being outside. And we have all these wonderful holidays. This was done just before Thanksgiving. We're coming into the Christmas and Kwanzaa and Hanukkah season, followed by MLK Day, New Year's, MLK Day, Black History Month, Valentine's Day. So we're in a season where, as social creatures, we want to be together. That's just who we are. And so to tell us to say you can't do that, which is what this virus is really saying, goes against our nature as human beings. And then, of course, we have college students returning home. So the take home from our time recently has been be proactive now, especially now with all the COVID preventions, so we can reduce disease and loss of life and long-term impacts. And I know that goes against how we're feeling because we're just really just exhausted from the things we've had to do. But the good news is that there's hope on the horizon. I just simply added this just to show you where we are. This is the USA. This is where we were in September, when I might have been with you with 42,000 cases in the US per day. In November, after the Halloween holiday, and things have a delay from the time of exposure to the time the cases show up. So on November 14th, we recorded around 159 cases. And as of December 1st, this was the number recorded in the US. And unfortunately, I anticipate that these will go up as the results of the holiday travel come in. So what I'm trying to say is that we're in a surge time where we really do have to do what we have to do to keep ourselves and our families safe. This is just a reminder, this is also in the recording of the timeline that previously Dr. Levy showed us or talked about, from the initial exposure to the time symptoms appear, if they're going to appear, to the time of the previous standard quarantine. And remember that virus is being shed from early on, before symptoms show up. Some people never even have symptoms. And now we know about 40% of the people who share virus, or where virus is spread, is from subclinical asymptomatic infection. So people who never get sick. So that's why we have to always be diligent to wear masks if we're around people that are not our immediate family that we have remained safe with. And so this is looking at what goes into the air, and if that gets inhaled, then we end up having an exposure. This is also to remind you of what we have to do: physical distancing, staying home, and of course in the holidays, this is even more difficult to do because we get together with family and friends. But it's important to make this year, the holiday season, different, because if we can do it well this year, then hopefully by next year, we'll be in a different season and a different time. And these are all things you know very well. We just talked about the importance of testing and getting tested early on, if you, or at least within the first 3 to 7 days, if you think you've had an exposure, the contact tracing. And then there's research going on. You've heard about the vaccines. We now have 2 vaccines that are coming before the FDA in the US for approval. And so hopefully those will be available, but they realistically won't get to most of us until probably March, April, May, June. And we also don't know how long they'll last. Fortunately, they're very effective, is what the data are currently saying. We now know something about long haulers, that even people who don't get severe disease, who may get mild or moderate COVID, have lingering symptoms. So again, this is something that, you know, young adults used to think, well, gee, I'll just, you know, I'm not going to get sick, I'll just do this. But we're finding that many of those people do actually have very devastating long-term symptoms 2 to 3 to 6 months after the exposure or after the infection. So how do we navigate the holidays and winter seasons? Make a plan. Make a plan with your family, your friends. You know, we said for Thanksgiving, and we'll say this for Christmas and other holidays, you know, yes, we want that great dinner at auntie's or grandmother's, but, you know, have them, if you have to have it, have them make it, and put some containers or plates on the front porch or back porch or wherever. Or make it a different holiday where you connect in some other way, but you stay physically safe, just showing the love that we need to have for one another. If you're going to travel, and we're suggesting that you do not travel, that you stay in your own home with your own family unit that you have been sheltering in with. And I have a few suggestions as to how to make that fun, but do not gather with others. And we'll talk about these pods in a minute. The 3 W's, wear your mask, wash your hands, watch your distance if you're out away from home. Avoid crowds, confined spaces, and close contacts. And then if symptoms appear, or you've been in contact with someone that may be sick or test positive, as was just mentioned, the testing and tracing contacts is so important. So we can take these actions to reduce the coronavirus spread through this holiday season. This is just a reminder that the safest thing is to stay home in your own unit with people you know who are negative and who have stayed home. The next safest thing is if you're going to be out, is for everyone to wear a mask and to maintain your distance. And then we get less safe or more risk as we go up from not maintaining distance and not wearing masks. So these are the best things we can do. And remember, if we can get through the winter season here, there is help on the way. So the takeaway message is remain proactive to always use preventions. Make and implement a plan for this 2020 holiday season in this wintertime. Expect or require or model compliance. And I know we're tired, but if we can do this now, we can get through this sort of last stretch to hopefully a new normal where we will have vaccines on the horizon, which won't solve the problem, but it'll just reduce the ability of COVID to cause severe disease at the minimum. It takes a minimum to 7 to 10 days before behaviors show up. So I tell you, in the next week, we're going to see increasing COVID cases from the travel over the Thanksgiving holiday, because people in general, lots of them are not listening. Every one infection prevented stops at least 5 exposures, which stops deaths. So practice self-care, especially this time, for emotional, mental, spiritual well-being. And I'm going to talk a little bit about that if we have time. So this is the last slide again that shows you the YouTube place where you can get the 90-minute session. And really the darkest hour is just before dawn. We're at that point. People have said this is going to be a dark winter. Well, it can be, but it can be a lot easier and a lot less detrimental if all of us stick to what we know works, such that we can come through in the spring and the light can shine into our lives. So I put that YouTube address into the chat, and I hope that you will go there. Everyone that's seen it has really been quite thankful. I've gotten lots of emails, mainly because it's simple and clear. And so then what can you do now to make sure that you are being safe and that you can help your family? There's a question about the pods, and I will answer that. I'm going to stop here and simply wait for questions. But I do want to say the COVID fatigue is real, and yet the need to remain in your own unit, keeping your children and your loved ones with you where you know they're safe, they're negative. Whenever you go out of the home, being sure to diligently practice the masking and the watching distance. And don't be afraid to tell someone, you know, I need you to step back, or I need to step back. These things make a difference in reducing the amount of virus and reducing your exposure and keeping you safe. Then when you're in your home, there are things you can do. Someone told me the other day about, or in a conversation about their family having staycations, which is probably not new to you, but taking a weekend or a week, several days in the week, or even 2 days, and just nobody works, nobody goes to school, nobody does anything. Pretend you're in some other place, put up a tent with a sheet somewhere and camp out in your living room or in your bedroom. Look at some favorite movies. Talk to each other about your heritage. Tell stories. Do your nails, do your daughter's nails or your son's hair or something. Make these moments count, because, you know, I used to wonder, you know, when can my family get together? And we have 3 grown children. They're in different places, but we connect now and talk about things that we never had the time to talk about before. My older brother is going to do a family history on our family call this Sunday, where he's traced a lot of our ancestors. He's going to put it up on a slideshow. We wouldn't be still long enough to do that if we were in the same place. So this is a season to do things differently. And I'll stop there.
Thank you, Dr. Fuller. And what a wonderful reminder of in what has been very tragic and difficult at times, the lightness and the peace that we can find and in this time. We do have a few questions. Do you think the reasons numbers are going up is because people who look fine and feel fine are never being tested, but in reality, they have COVID?
Absolutely. The numbers are going up because there are so many asymptomatic infections, or people who are infected who may later get sick, but pre-symptomatic. We know that now most virus is produced within the 3 to 6 days after exposure. And so if I'm going about my business and I don't happen to wear a mask, not me, but somebody doesn't wear a mask, then that virus is going into the air and other people will breathe it in. And so before anybody knows they're even producing virus, and they may never know, they end up having infected people. I have a number of folks on our morning prayer line for our church who have relatives where one of the father or the mother, one member got infected and is sick. And then it turns out that other people, when they test, because now they need to test positive as well, but there are no symptoms. So whenever those people were going out, they were also potentially expressing virus and causing infection. And that's what's happening. That's why we see such a surge, because people are tired and they want to go to restaurants and they want to go to the supermarket and they want to get together for birthdays and weddings, and that transmits virus. It's hard.
So I'm going to ask one more question.
Yeah,
it is. It's really hard. We all are feeling the fatigue and the need to get back to normal.
But if you can do it now, though, that's the thing. Vaccines are coming, so that's going to reduce the ability of people to at least get sick and hopefully also to produce virus. So it'll be a lot easier if we can just get through the next 4 months.
So one more question, and then there are two questions that I'd love for you to answer offline and make sure that we get the answer. So I'm going to say the two questions that we want you to answer offline, and then I'll give you the question if you could answer it right now. So does the vaccine stop the transmission of COVID? That's a question for offline. And how much spread is taking place from asymptomatic carriers? That's a question for offline. But the question that I'd like you to answer now is, do you think the vaccine will be safe? What about safe for people with pre-existing health conditions?
So first of all, there will probably be several vaccines. The ones that you're hearing about are messenger RNA vaccines, and they have are the ones that at least the one that's gotten approval in the UK, and the ones that are coming before the FDA are all messenger RNA vaccines. So you don't even get the virus. It's just a small piece of genetic material in a little lipid bag that gets put into your arm, and the body responds to that. So they are very, 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 very safe. They're as safe as any vaccine, and maybe safer than many. So yes, they're safe for getting it. What we do not know is the long-term effects after getting it. But my guess, and I can only guess because nobody's done that science yet, is that even these vaccines long-term won't cause a problem because they're just the RNA. Now, there are other kinds of vaccines that we'll be hearing about more from AstraZeneca and others that are live virus or virus vectors with some of the coronavirus in them. And that data, to my knowledge, is not publicly available yet as to what the content of those are. But the current vaccines, or the ones that will likely be approved in the US very soon, are safe for taking based on the data that's there. And what they do is they prevent disease symptoms. We don't know if they prevent infection. We know they prevent the COVID disease. So the data say that people who got the vaccine were 95% less likely to get symptoms than the people who got the placenta. Did they get infected? I don't know the answer to that. They just did not get disease. And my guess is they probably were a lot less infected, and they were not shedding virus. But I don't have the data to be able to answer that. The vaccine should
Thank
be
you so
safe.
much.
And to get out of this, we need to take it.
Thank you, Dr. Fuller. And it's so, we keep hearing about vaccines, but it's the details that you just provided are incredibly helpful. So you have those two questions offline that we'd love for you to answer. It was so wonderful to see you again. And so I'm going to kick it back to Jametta. Thank you, Dr. Fuller.
Yes, and thank you. So we've heard these complexities, and whenever we as human beings are faced with complexities all over the world, literally, whether we are part of a tribe, an institution, a family, we generally look beyond ourselves. We look for a spiritual answer. And we know through all of the pain that we've gone through. I shared some of mine, my husband, Leon Lilly, who lost his baby sister, many people in this audience. When we are in pain and we need to overcome things, we also look inside and we look on high. And to help us think about how we might incorporate some of those traditional ways of healing and helping ourselves. We're really so pleased to have come back to the program Reverend Larry Simmons, but also to be joined by Reverend Myla Reynolds as we think about how hope and faith is critical. Welcome.
Myla?
Hey,
Hey,
Rev,
my
how are
sister.
you? Hey. So I'm going first.
Yes, you got it.
You got
First, I want to
Beauty
thank
before
everyone.
age.
I want to thank everyone for the amazing work that you're doing to galvanize resources in our community. And I'll start off by saying, keep the faith. You know, we will win together. And so, in terms of keeping the faith, I want to talk about my meditation, or what I've been wrestling with, is how we're in a wilderness experience right now. And when Christ was in the wilderness experience and when he came out, there were three things that happened. The devil tempted him in three different ways, and he used the sacred text to even tempt him. The first was through food access, right? He said, turn this turn this stone into bread because I know you hungry, right? And so I want to say to us that we should not become anxious over access to resources, because this platform is just provided for us all the opportunities and resources that we need to be successful, to have access to food. We have this access through food banks that are almost on every corner. Even Detroit Public Schools Community District is still passing out food on Mondays and Thursdays. So we should not become anxious as to whether or not we have access to food and resources. And then the second temptation was, he said, you're the Christ. So if you were to just jump off this cliff and cut your foot, the angels will pick you up before you touch the ground. And Jesus' response was, do not tempt the Lord your God. While it is true, he is our healer, he is our redeemer, he is our God, we should not tempt God. And so I want to encourage us to wear your mask, stay home, wash your hands, stay with your small clusters, and that God is still faithful, but we shouldn't tempt God by saying that we're not going to wear masks, or we're not going to follow the medical advice, or we're not going to follow the guidelines of the CDC and the experts who are using their intellect and their expertise to guide us in what is right. And then finally, he says, listen, this is the enemy, the devil, the evil one, whatever name you want to give. He's saying, look, if you just worship me, right, I can give you everything in the world. And Christ ends by saying, go away from me. You shall honor the Lord your God and no one else. Listen, let's turn inward. Let's turn to God to know that God has everything that we need is already inside of us. And as much as we want to go to the structure of the church, the building is not the church. The church is the living spirit of God in humanity that breathed the breath of life of us in Mesopotamia, East Africa, that animated humanity. God is within us. And if we are going to use the wisdom of God, the nurturing of God, the knowledge and power and grace of God, then we will be all right. We are in this together. So I'll end by saying, Pumoja tutashinga. Together we will win. God bless you and keep the faith.
Hallelujah. Preach, preacher. Preach. Listen, I have I'm going to be very short because my sister has said what needs to be said. I want to teach you all a very, very deep theological practice. You have to go to school many years to master this practice, but I'm hoping I can share it with you right now. When you've had an opportunity to hear all of the information we've heard, and you've heard all of the different places that you should go, and you've sat with your child and had them melt down while they're trying to study for a multiplication test, I want you to practice this deep theological meditation and activity. Are you ready? Are you ready with me? All right, I want everybody.
Let it go.
Let it go, baby. You ain't got to sit in front of every video. Your child does not have to take every test. Come on now. The Lord has told us in Psalm 131, did you all know that the Old Testament of the Bible is also shared by Muslims and Jewish people? In this sacred text in Psalm 139, it says, we are fearfully and wonderfully made, which means you got the authority to decide, turn the TV off. You got the authority to say, you know what, Mr. Teacher, my baby can't handle this today. I'll check back in with you next week and it's all good. We're going to get under Dr. Fuller's tent. We're going to spend some time reading the Bible like Dr. Maya just gave us. Hey, y'all, guess what? I'm out.
Well, family, I think we're feeling uplifted, right, Christine? We're gonna be able to stay safe, stay strong, and Dr. Avetta said, stay merry, based upon being filled up with what's in us as we look up and look out. I'm handing it to you. I'm feeling glorified. In the midst of the trial.
You know what? Yeah, I had a 2020 kind of day yesterday, and both of what you all just said made me smile. So, and I did a little bit of that yelling, Rev, yesterday with a few tears.
That's okay too.
So,
you can Jesus wept.
Yeah.
Yeah. Thank you. I appreciate that. So we're going to wrap up now. We want to thank each of our experts and panelists for joining us today, and we want to thank each of you for joining us today. If your question wasn't answered, remember that we will get the answer for you and we'll post them next week on onedetroitpbs.org and on the DPTV Facebook page. We want to hear from you. So, and we can hear from you all week long because we have a way for you to text us. So if you have questions, comments, or you want to hear from somebody, please text us at 313-288-2082. That number again is 313-288-2082, or you can put that info in the chat right now. And so we hope to see all of you next week. But before we go, we always have a few asks, and we want to recommend that everyone, if you can, download the COVID app that's brought to us by, I believe, the Michigan State Department of Health and Human Services. It's a way for you to report if you have COVID, and then for you also to get alerts if there are folks around you that have COVID or there's been some tracking. I think that our producer Molly is sharing the screen right now so you can see what it looks like. It also has a map so you can see where infections are increasing, and it's an interesting app. The second thing that we're going to ask is that you join Detroit Parent Network for their annual meeting. All are welcome, and they will be celebrating powerful parenting, shining our light through the pandemic. This annual meeting is on Saturday, December 5th, 2020 at 10 a.m. It's 2 hours, and it's a virtual family affair. To RSVP, we are going to drop a Zoom link in the chat right now, and or you can go, I'm assuming, Jametta, to the Detroit Parent Network Facebook page.
That's it.
Yep. And then also, if you need help with online platforms, which I think we all can use some help sometimes with online platforms, Detroit Parent Network will be offering free Tech Light workshops starting next week. So you can get that information on their Facebook page as well when you go and sign up for their annual meeting. This town hall is truly a group effort. So before we go, I'd like all of our partners to turn on their video. And we want to remind everyone to stay healthy, stay powerful, and stay strong. And I am going to say, and find peace. Yes. We all need peace right now. So Cindy, if you are still on, can you please say that in Spanish?
Mantente fuerte, mantente saludable y mantente seguro.
Thank you. Everybody have a great rest of the week. See you next week.
Everyone, stay safe, stay